Today we will be asking Dr. Mullarkey some questions about her opinion on the novel coronavirus of 2019. Dr. Mullarkey is a Rhodes Scholar and has received her doctorate from the University of Oxford, where she worked on a novel influenza vaccination strategy. She completed a postdoctoral fellowship at the Icahn School of Medicine at Mount Sinai in New York under the mentorship of Dr. Peter Palese. During her postdoctoral studies, she continued to investigate immunological responses to influenza and flu vaccines.
So, coronaviruses are actually a very large family of RNA viruses. They are actually even though there's a novel coronavirus or a new coronavirus that's circulating, they're actually very familiar to humans. So probably about 10 to 30% of colds that people experience over the winter months and cold and flu seasons are caused by coronaviruses. I think a lot of the question on people's minds is how worried should we be about this outbreak? I think as a global scientific community, there's definitely evidence to have some healthy concern around this new virus and how it's spreading. We're certainly going to learn a lot about public health measures and this particular new virus. When we talk about, here in Canada, here at McMaster, should we be concerned? Not yet, right? So there are 4 confirmed cases in Canada. What you should be more concerned about is the flu. All right, so the flu, and I can't quote data exactly for Canada, but in the U.S., all right, there are millions of cases of flu. Right, we're talking about in China this new coronavirus, tens of thousands. There's millions of cases of flu. There's hundreds of thousands of hospitalizations, and there's tens of thousands of deaths. So if we want to be concerned about any virus this particular winter season here in Canada, okay, be worried about the flu. So we have to. The probability that this virus is going to pose a problem for the Canadian population right now is low. There's good detection methods. All the global health agencies are aware and monitoring the situation very closely. The risk is probably low. I think China probably imports more animal products from us than we do them. They have put a ban on any wildlife trade in China. So maybe it'll help if I speak a little bit about where we think the SARS outbreak came from and what we know about this particular coronavirus. So coronaviruses, as I said before, can affect a wide number of species. The SARS outbreak actually came initially from bats, transmitted from bats into civet cats, which are a delicacy in China that people eat. And so these civet cats would be at these live markets. People would eat them, people would butcher them, and then be exposed to the virus. So there was an intermediate host before this coronavirus, SARS coronavirus, got into humans. This new coronavirus has a 96% sequence identity to a bat virus. So probably came from bats. What we don't know at the moment is if there's any intermediate species. So whether it's infected something else before it's gotten into humans, or maybe there's a direct transmission from bats to humans. There was a live fish market or a live wildlife market that's been associated with the center of this outbreak. So when the first cases were first identified in Wuhan in December of 2019, somewhere between 50 and 60% of the people that presented in hospital had been or worked at this live market. And so this market brings together all sorts of wildlife that wouldn't usually come into contact with each other. So they could have things like bats and civet cats and snakes and all sorts of things. So potentially that could have been the reservoir for this particular outbreak. We don't know yet is the answer. So there's certainly evidence that now that there is human-to-human transmission, so that's now predominantly how it's been spreading, but we can't rule out that there might be some contamination of animal products. Oh, I think that the Chinese markets have already taken a hit, and it's probably hard to know. Again, the situation is evolving very quickly, and it's probably going to be a while before we know the full extent of the impact on the economy, but I think we're already seeing that happen. Yeah, I mean, I think that if you're, depending on where you're traveling, right, we can be, more or less concerned about your chances of coming in contact with somebody that's infected with the coronavirus. I would say, like anything during the winter time, use good hand hygiene. If you're not feeling well, if you think you are sick, stay at home. Don't infect a whole lot of other people. As long as you're not going to, Wuhan, I think that you can be reasonably confident that your chances of contracting this are very low compared to a lot of other respiratory illnesses that you would come in contact with over the course of the winter. Yeah, so unfortunately, in today's age, not all sources are created equal, right? So there are some really good media outlets, and there's some really good online information with regards to this virus. The CDC has good information. The WHO has good information. There's certain academic institutions that are tracking this in real time. Johns Hopkins has an amazing site where you can see all the cases globally and where they are and the number of confirmed cases. But when you read news articles, so things that aren't being put out by academic institutions, there is a tendency to sensationalize. And you have to keep that in mind when you're reading these articles, right? So unfortunately, papers are trying to increase viewership, and they want you to read what they've written. And so I think there is a tendency to sensationalize. There can be some very accurate and good reporting, but you should always take certain news outlets with a grain of salt.